Hi, I am Dr. Dures Fei Tagayuna, and I will be the faculty for this 18th lecture for Legal Medicine entitled Abortion. Abortion is the forcible expulsion of the contents of a gravid uterus anytime before full term or before the age of viability. And viability is that point at which the fetus is potentially able to live outside of the mother's womb without respiratory aid. From a legal viewpoint, abortion is the willful killing of the fetus in the uterus or violent expulsion of the fetus from the maternal womb and which results to the death of the fetus. The elements of the crime of abortion are that the expulsion of the product of conception is induced and that the fetus dies either as an effect of the violence used or the drug administered or that the fetus was expelled before the term of its viability. These are the clinical types of abortion. Missed abortion is when the ovum is destroyed by hemorrhage into the chorionic space, usually before the fourth month of pregnancy. This is followed by death with maceration or absorption of the product of conception. Threatened abortion presents with hemorrhage but without dilatation of the internal os. Inevitable abortion, however, presents with hemorrhage, dilatation of the internal os, and the presence of rhythmical pain. This may end up with the expulsion of the fetus and may require medical intervention. When a fragment or portion of the product of conception is retained, or not all the products of conception are expelled, this is what you would call an incomplete abortion. And the complete abortion is when the whole product of conception is expelled. There are provisions in the revised penal code on abortion. The revised penal code of the Philippines has penalties for intentional abortion, and the elements are that the woman is pregnant, of course, that the violence was applied or a drug was administered, and it is a person that performs such acts upon the pregnant woman, that the effect of such violence, drug, or act is the death or expulsion of the fetus, and that the offender has the intention to abort the pregnant woman. Any person who shall cause an abortion by violence, even if unintentional, may be punished with the penalty of prison correctional. The woman must be pregnant. The violence was applied on such a pregnant woman without the intention of aborting her, and the woman aborted as a result of the violence. When abortion is practiced by the woman or by her parents, the penalty is prison correctional. The elements of the crime are the woman is pregnant, abortion is intended to be committed, and the abortion is induced either by the woman herself, other persons with the woman's consent, parents of the woman, or with the purpose of concealing her dishonor and with the woman's consent. When abortion is practiced by a physician or midwife and when they participate in the dispensing of abortives or abortifacients for that purpose, this is considered a crime. The requisites are that the woman is pregnant, that the doctor induced or assisted in causing an abortion, and that the acts done by the doctor of midwife was intended to cause such an abortion. These are the kinds of abortion that has medical legal relevance. Spontaneous abortion occurs without any form of inducement or intervention, and induced abortion occurs due to some form of inducement or intervention. There are also two types of abortions: therapeutic abortion, done purposely to preserve the life of the mother, and criminal abortion, done without therapeutic indication but with criminal intent. The postmortem abortion is defined as the expulsion of the product of conception after the death of the pregnant woman, and this is due to the contraction of the uterine muscles during death. The reasons why women procure abortion: one, to preserve the life and health of the pregnant woman, to second, to terminate prematurely illegitimate pregnancy in order to conceal the dishonor of the woman, third, financial difficulty. This is going to be another mouth to feed. And fourth, to preserve the body form of the woman. It would be good for a young physician to know the ways of inducing abortion, and there are many. First, by general violence. This includes intentional violence, such as exerting strong physical effort, such as horse riding, cycling, strong pressure applied on the abdomen, and other forms of strenuous and exhaustive exercises. By means of local violence, this includes violence applied or trauma applied locally in any portion of the generative tract. The more common methods of induced abortion applied locally to the generative organs are the warm or cold douche, the injection of fluid into the uterine cavity, the use of an luminaria tent or tangle tent which dilates the cervix, the use of soft rubber inserted into the cervix, or the dilatation of the cervix by any form of instrumentation. The third way to induce abortion is through the use of drugs, and this is commonly resorted to. These drugs may effectively cause abortion through different mechanisms of drugs that act on the uterus, whether directly or indirectly, include the emmenagogues and the ecbolics. The emmenagogues are substances which increase menstrual flow. There are direct emmenagogues that act directly on the uterus or on the nervous system close to it, for example, ergot and cantharides, or this cantharide is a Spanish fly that has been reported to be an abortifacient. Or indirect emmenagogues, which induce or increase the menstrual flow by promoting or building the health of a person as a whole. This is classified as either a tonic, which includes iron and strychnine, or hematinics like iron, copper, and liver, or purgatives like magnesium sulfate and castor oil. Ecbolics, on the other hand, are substances that, when taken, cause death of expulsion of the product of conception by stimulation of the uterine muscles. The most common embolics include ergot, quinine, pituitary extract, lead, and mercury. Other drugs that induce abortion are those that act reflexly through the genitourinary tract. They produce irritation of the GUT and incite abortion by reflex uterine contraction. The examples are oil of pennyroyal, oil of Tamsi, and oil of turpentine. Another group of drugs that induce abortion are those that act reflexly through the gastrointestinal tract. The principal site of action is the GIT, but may cause uterine contraction by reflex. The examples of these are castor oil, magnesium sulfate, croton oil, aloes, elatrium, and gamboge. Finally, there is that group of drugs that induce abortion because of their poisonous effects on the entire body. The action is not localized but affect the whole body, such as animal, vegetable, and mineral irritant poisons. And, of course, by surgical intervention, abortion by application or the use of instruments by either a gynecologist or surgeon, which could be dilatation and curettage or hysterolaparotomy. And there are modern methods of inducing or producing abortion, such as amniocentesis, which is the uterine injection or of hypertonic saline or glucose solution, or the vacuum suction, known also as a menstrual regulator, may be applied through the cervix. This creates negative pressure to detach and break up the product of conception. The medical evidence of abortion in the living include the presence of external signs of violence in the form of contusions, abrasions, hematoma, open wounds if induced by general violence. There may be signs of vaginal instrumentation like lacerations, contusions, hematoma upon examination of the generative tract. Examination of the instrument will reveal the presence of blood, placental tissue, or fetal parts. A good history will reveal health of the woman before and after abortion. And of course, there should be signs of previous pregnancy. There are evidence of abortion observed at autopsy, and these are evidence of instrumentation such as the punctured wound in the placenta, placental remnants may be found inside the uterine cavity. Examination of the stomach and the contents, abortifacient drugs may be found in the stomach on chemical examination. The examination of the kidneys and other organs can show irritants that caused the abortion. Examination of the uterine contents can reveal the stage of pregnancy, any infection, or other complications of abortion. Biological tests can reveal paternity, and a pregnancy test will confirm the pregnancy. And the presence of some untoward effects of abortion, like infection, embolism, fistula formation, or pelvic adhesions. It is not easy to prosecute physicians committing the crime of abortion for several reasons. One, the crime is performed secretly. Two, the physician has several medical reasons to justify his actions. In most cases, the expelled fetus, which may be utilized as the corpus delicti in the crime, is lost, and the pregnant woman is usually in connivance with the physician. Also, sadly, medical society has a lukewarm attitude in helping the state to prosecute the abortionists. Thank you very much for your kind attention.